Hello and welcome to the Food Allergies and Intolerances Masterclass. My name is Dr. Beata. Food allergies are such a wide topic, and today we're going to be decoding the most common presentations, including IgE-mediated allergies, non-IgE-mediated allergies, intolerances, reflux or GERD, eczema, celiac disease, CMPA, MSPI, FPIAP, FPIES, EOE, MCAS, food intolerances, food sensitivities, and more. And if you are breastfeeding a baby or a little one with food allergies, make sure you listen in as well. And as we go through, make sure you watch throughout the entire video to explore the differentiation of all of these different kinds of food allergies and intolerances that I mentioned. You're going to learn practical management strategies and gain a deeper understanding of how to support yourself or a loved one with food allergies and go on this healing journey. And I'm going to share more about my own personal experiences and my daughter's experiences and our healing journey as well. And as I go forward, I'm going to use the word food allergies as a global term to discuss and to cover all of these conditions. And I'm going to differentiate certain ones later on as we go, as we dive deep into each one. So you're going to get a really good understanding of them. And throughout this masterclass, I also encourage you to be interactive. When you are interactive, when you post in the comments and you interact and engage, you'll actually be able to remember more. You'll be able to incorporate more into your journey. You'll help others feel a sense of community, and you'll get this information out to even more people. And so if there's someone that you know who would benefit from learning more about food allergies, maybe it is a family member or a friend, a caregiver, a support group, a school system, whatever it may be, take a moment to tag them now and hit the share button. Because the more people that are aware of food allergies and know how to support others with food allergies, we are going to experience so much more ease and safety really in our lives as well. So make sure you share this video and this masterclass. Now, I do want to know, are you watching live? If you are, go ahead and do hashtag live. If you're watching the replay, go ahead and do hashtag replay. And let us know where you're tuning in from, because food allergies affect people all over the world. Myself, I'm in Massachusetts right now in the northeastern US, and I see clients in person in Connecticut and Massachusetts, and I also work virtually with clients all over the world. I've worked with families and individuals all over the US, in Canada, in Europe, and Asia thus far. So again, let us know where you're watching in from. And for those that are watching live and during May of 2024, which is National Food Allergy Awareness Month and Celiac Disease Awareness Month, stay with me to the end for a special offer that is only good until May 30th of 2024. And as we are watching, go ahead and let me know in the comments, who are you watching this masterclass for? Is it for yourself? Is it for your baby or your child maybe? Maybe it's for a family member or a friend. Maybe you're a practitioner who's wanting to learn more about food allergies and how to support your patients and clients better. Go ahead and put practitioner in the comments if that is you, because I have a new mentorship for practitioners to discover how they can use my approach, the Radiant Health Protocol, which I'll be talking more about in depth as we go through the masterclass, to transform health, wellness, and the lives of their clients, to access healing, to save time and resources, and make a profound impact on the world. Because we can overcome whatever health and wellness challenges are presented in front of us. And this is the way to get to all of the underlying root causes and absolutely transform anyone's experience. So also let me know in the comments, how old is the person with food allergies that you're watching for? And how long have they had food allergies? Have you been on this journey long, or are you just starting out? This gives me great information as far as what kind of support to provide for you, what kind of videos and masterclasses to make for you. And it's interesting to see the different ages. And personally, I've worked with the tiniest of babies. I've worked with toddlers and children. I've worked with teens and adults and women in menopause and seniors. So again, food allergies affects the lifespan, right? They can occur at any time, which we'll go over more in a minute. And, you know, they're They don't discriminate to a certain age or anything like that. So also let me know, how long have you been into holistic and integrative health and medicine? Are you just starting out? Have you been exploring it for years? Or are you a veteran, again, maybe a practitioner or someone who has been really studying this for a long time? And I also want you to put in the comments if you are breastfeeding. So if you're a breastfeeding mom who has a little one with food allergies, or you yourself have food allergies, put breastfeeding in the comments. The reason why is I have so many resources for you, and this is how my personal journey with food allergies started. So I made so many resources because that is a subspecialty when we're dealing with the sensitivity of a little one with food allergies and that breastfeeding dyad. So make sure that you put breastfeeding in the comments, and I'll be sure to send you those resources. It includes free workshops, videos, trainings, and more. So as we get going here, I want you to know that I will be referring my notes, but please do post questions and comments in the chat, and I'll make sure to come back and read and answer all of them personally and give you lots of resources depending on your needs. And I did want to include this disclaimer as well, that this masterclass is for educational and informational purposes only, and it is not medical advice. Make sure you check with your provider and work with a practitioner before making any changes. All right, let's dive in. So do you want to gain a deeper understanding of food allergies? Or maybe you're a parent, a caregiver, a family member, or a friend of an adult, a baby, or a child who has food allergies, or you believe has them. Or maybe you're an adult who knows that you have food allergies or suspects that you have food allergies or intolerances, and you want more information. And again, maybe you're a provider whose patients have brought up food allergies and you want to learn how to support them better. You are in the right place. As a mom, a practitioner, and a mentor, I understand the challenges of getting answers and support when dealing with food allergies. Keeping yourself or your little ones safe, working through formula or breastfeeding challenges when they're little, figuring out what to eat, how to avoid triggers, how to manage reactions, sleepless nights, pain, and the guilt that comes when your child does have a reaction or if you slip up. I know the overwhelm and I know the fear. I know the anxiety and the worry. It's hard. I want to validate that, and I don't want you to get stuck in that hardness. I want you to know that there's hope, and I want you to know that you will get through this, and your child will get through this too. And the reason why I say this is because I've been there. I know how you feel. I've been there personally, and as we go through this whole masterclass, I'll be sharing more about our journey. And so this hope that I want to spread is that not only will you get through this, but you will thrive, and you will be able to learn how to heal and experience health and wellness and vitality and radiance in ways that you never imagined. So I invite you to take a moment and put your hand on your heart and really feel that. Know that it is possible for you. It is possible for you to thrive with food allergies. It is possible for you to heal through food allergies and to overcome having reactions, signs, and symptoms. Take a moment to really internalize that and hold that space for the possibility and opportunity for you as well. Again, I know this because I've been there. My daughter's been there, and dozens of clients that I've worked with have been there as well. My daughter was one of the most sensitive that our practitioners have ever seen. And personally, she went from a list of over 40 triggers to a handful with much milder reactions, and the progress only continues. She was one of the most sensitive that our practitioners have ever seen, and we had the most work to do out of the ones that our practitioners have ever seen. And that's why during this process, I had to really uncover and discover the actual underlying root causes of food allergies and how to address them holistically for healing. So you don't have to waste your time on trial and error like I did. And if you're a practitioner, they don't teach this approach in school. That's why most allergists and conventional medicine doctors, they just haven't been taught this. They don't know. It took me years of trial and error, even after my doctorate, residency, and fellowship, working with various mentors, learning and applying different approaches to fine-tune the system. And I'm excited to get the word out and help even more people heal and achieve this radiant health, and help other practitioners through my mentorship as well. And again, if you want to become a practitioner, if you are a practitioner and you want to learn how to use this system to get even better results for yourself, for your clients, for your families, save time and resources, and make this profound impact on health, on the world, put practitioner in the comments. Through this experience, my daughter's journey with food allergies, and my own journey of overcoming digestion struggles, food allergies, autoimmunity, and more, I've developed the Radiant Health Protocol. This is a revolutionary system with 6 pillars that addresses the underlying root causes of food allergies and any other health conditions, and empowers you to address the root causes, to thrive, and to live your best life. Put a 1 in the comments if you want that. So in this masterclass, we're going to go in depth on the 6 pillars that will transform your health and how they relate to food allergies. I'm going to share about our food allergy journey. I'm going to share valuable insights and strategies that have been refined over years of research and practice. You're going to get a deeper understanding of food allergies. You're going to explore differentiation between the different types of food allergies and intolerances. And you're going to discover the signs and symptoms to look out for, as well as the contributing factors. You're going to learn practical management strategies. You're going to get encouragement and support from someone who's walked this path before and emerge stronger on the other side. So make sure you watch to the end, where I cover frequently asked questions. I address myths throughout the whole masterclass, and you're going to get tips and action steps sprinkled throughout so that you can start your journey today. And I'm also going to extend an invitation for a discounted support package for those of you who want to skip the mistakes, who want to get results faster, who want to feel confident and calm on this food allergy journey by working together. This includes a full month of support, a one-on-one consultation, assessment, evaluation, resources, multiple checkpoints throughout the month, and more to create your personalized plan and customized solutions for your healing journey. My name is Dr. Beata Harashim, and I'm a holistic and integrative doctor. And I work with clients with all sorts of signs and symptoms and diagnoses with the Radiant Health Protocol. And I actually began my private practice specifically to support breastfeeding moms of little ones with food allergies. And there's different names for this. It could be FPIs, CMPA, MSPI, FPIAP, MFPI, and more. We'll go into what all the abbreviations mean later on, especially if you haven't heard them before. Allergy breastfeeding is my subspecialty and a group that I hold so dear to my heart. Again, comment breastfeeding if this is you, because I remember how few resources there were when we were in the depths of this, and I have so many resources for you. Free workshops, videos, I even wrote a supportive book about our experience with guided practices for you, and more. And this book is actually really beneficial for anyone on this food allergy journey. I wrote about it in the context of my breastfeeding experience, but anyone going through food allergies is going to benefit with the guided practices, support, and strategies in this book. It's on Amazon. It's called Breastfeeding Bliss, and I'm going to talk more about it later. So as I was working with this breastfeeding population, I had moms approaching me who were formula feeding, who stopped breastfeeding and now their kids were older, who just had older kids, or the moms themselves needed support. So as I was working with this population, I realized that this approach that I created for myself and my daughter was so unique and transformative to support anyone, no matter what stage of life they were in, no matter what conditions or diagnoses they have, no matter what signs or symptoms they were presenting with. And especially food allergies, they are much more prominent than most think. Oftentimes they're undiagnosed or misdiagnosed, and they're prominent in both kids and the adult population as well. And we'll go into, again, differentiation and signs and symptoms in a couple minutes. So this masterclass is part of a full masterclass series. In this masterclass series, we go through the pillars of the Radiant Health Protocol, and they are holistic nutrition and nourishment, integrative detoxification, comprehensive gut health and healing, nervous system regulation, emotional energetics, and decoding the body. These 6 pillars are transformative. When you learn how to embody these and how to apply them, everything changes. The healing process can begin and accelerate. And the next videos after this one will each focus on one pillar of the Radiant Health Protocol with lots of tips and action steps throughout so that you can start transforming your health today. So comment series for the link to sign up for the entire free masterclass series to get bonus resources and to make sure that you don't miss anything. And if this approach of addressing root causes resonates with you, this holistic and integrative approach, and you're ready to identify and address what will create the shift for your food allergy journey, put Radiant in the comments and click below and get the discounted package with a month of support today. Because the truth is that you can't achieve wellness and optimal health and well-being by only looking at one pillar, whether it is an elimination diet or gut health or emotions or energetics. That's where we got stuck on our personal food allergy journey. And I discovered we needed a comprehensive, holistic, and integrative system. That's what I made the 6 pillars of the Radiant Health Protocol based on. And put a 1 in the comments if that makes sense, or put a 2 in the comments if this is new to you, because we're all at different places on our journey. And I remember when all of these concepts were really new to me. I had a degree in nutrition, I had my doctorate, I had my residency and fellowship, but putting all of these pieces together, and especially the emotional components, the energetic, the nervous system regulation, all of that was really new to me. And I was curious. I wanted to learn more because I was intrigued by it. I had seen people's testimonials and people sharing their stories of how much of an impact this made in their lives. And I really wanted to learn more. So no matter where you are on your journey, know that it's okay. If you're just curious about things, or if you have been learning about this for a while, all of this is going to be so important and apply to you as well. So what I've discovered is that the root causes, the underlying reasons for any signs, symptoms, or conditions are the same in each person, but they present themselves differently and to a different extent in each person. So in the food allergy world, some may have anaphylactic reactions. Others may get hives or eczema. Others may get vomiting. Others may get diarrhea. Some may even get mental and emotional symptoms, and many more. The root causes of all of these signs and symptoms, conditions and presentations are actually the same. And before we jump into the information and learning more about the root causes, I want to have all of you experience at least part of the system and the Radiant Health approach. Because this is transformation that we're dealing with. This is health transformation. This is not just some information that you read in an article online. This goes way beyond that. This is an experience. And a part of this is understanding the difference that your journey, your food allergy journey, your health journey is having on your life right now. So I have 2 questions for you. And I invite you to grab a journal, a piece of paper, a pen, and just jot down what first comes to mind for you. And when you think of your current situation with food allergies, whether that's you, yourself, your child, a family member, a friend, how is this affecting your life currently? Food allergies don't come in isolation. They affect our lives as a whole. They affect our relationships. They affect our stress levels. They affect our mental and emotional health, our mental load, especially for moms. They affect time for business, for our career. They affect social situations, especially all of the social events and things like that that have food in them. They affect social interactions, our finances when we're having to get special foods, etc. They affect the ease and the joy that we feel on a daily basis. And I invite you just to bring some consciousness to that. How are food allergies affecting your life currently? If you're watching the replay, feel free to pause and take a couple minutes to write down everything that comes to you. For those who are watching live, the replay will be available, so you can come back to this exercise or just continue your journaling afterwards as well. All right, so question number 2. How would your life be different if you had clarity, confidence, and certainty on your next steps with food allergies? What if you knew how to approach food trials? You knew which foods to trial and which ones to avoid for your specific individual circumstances. What if you knew how to deal effectively with reactions when they did happen? And what if you didn't have that many reactions? How would that feel? How would that transform your life? What would become possible for you? And what if you gained new foods? What if foods that you reacted to in the past, you didn't anymore? How would that feel? How would that transform your life? What would become possible for you? I want you to spend some time really experiencing that. What if you knew how to support yourself or your child's body for optimal health and wellness and the best start to life? How would that feel? How would that transform your life? What would become possible? And what if you knew that this experience was actually going to set you up or your child up for radiant health moving forwards? How would that feel? How would that transform your life? And what would become possible? Take a moment to write down your thoughts, what comes to you, what emotions you're feeling, and experience the expansiveness and the possibility and the opportunity that is available to you. Now, this is an example of something that we do during the Wellness by Design mini retreat. So if that's something that you'd like to go even deeper onto and create this vision of your health and wellness and opportunity and possibility, go ahead and just put retreat in the comments and I'll get you that information. So now that you've got some clarity, let's get clear on your why. This is what's going to keep you motivated and inspired even when things get tough. Even when obstacles get in the way, we need to be clear on our reasons, our why first, before we talk about strategies. So again, get that journal, and I invite you to just jot down the first number that comes to your gut response when we're thinking of your why, your motivation, your inspiration. So on a scale of 0 to 10, how motivated are you to transform your food allergy journey today? 0 is not at all motivated or inspired. 10 is you are ready to go. You are signing up right now. What's your number? Whatever it is, there's no judgment. Nothing is right or wrong. Just write down whatever number comes to you first. What's your gut response? 0 to 10. How motivated are you to transform your food allergy experience and journey today? Now, the second question is, why didn't you choose a number lower than that? So for example, if you chose a 6 out of 10, why didn't you choose a 4 out of 10? Or 3 out of 10 or 2 out of 10? What is it that's motivating you? Because the answers are there. They are within you. This is something that I can't tell you. Every person is so different, so unique, and only you have it within you. And this clarity is what's going to get you through. This is your motivation. These are the reasons why you know that you need to make a change today, why you need to transform your food allergy journey and experience today, not tomorrow and not next week. And for those who sign up for the free full masterclass series, you'll also get a special guided practice to go even deeper on your why. So make sure you put series in the comments and I'll get you the link. So now I'm going to share a little bit about my story, our journey, my daughters and I, because this is not just some theory or philosophy. This is true lived experience for myself, my daughter, and dozens of clients that I've worked with. And so my beautiful daughter came into the world, and our journey began very early on with eczema, baby acne, colic, reflux, straight blood and mucus stools, vomiting, and many other smaller signs and symptoms. We were breastfeeding, and she would be nursing for up to 20 hours a day, and otherwise only wanted to be held or worn. I would hear her cries, and my body would feel like it was shutting down. And they weren't regular cries. No tears. These were screams. Screams of pain that I can only imagine. And when she wasn't crying, they were phantom cries that would exacerbate my anxiety. I was a total wreck. I was confused, I was overwhelmed, and I was scared. I referred to this time as panic. Our doctors at the time weren't helpful. Family and friends didn't know how to help. And I set out to get my baby feeling better on my own with whatever information I could get. And I made so many mistakes. Even with my nutrition degree, my doctorates, all my healthcare background, I still made so many mistakes. I ended up going back and forth, not knowing where to go next. And through all of these mistakes, we learned a lot. We began with something called the breastfeeding elimination diet. I cut out food, so many foods. I kept cutting and cutting and cutting because we weren't seeing healing. We weren't seeing improvements. We had different reactions. We were down at one point to a 2-food elimination diet. Mentally, emotionally, I was drained. I had so much anxiety and worry, and the lack of support from my partner at the time, family, friends, having a hard time finding practitioners who understood what to do with us. That period of time was one of the darkest of my life. I finally ended up figuring things out on my own to a certain extent, and I started learning more and more about food allergies. We went to different practitioners. We went to naturopaths. We went to functional medicine doctors. But all they wanted to do was give my daughter supplements. And you had to wait weeks or months for appointments. But we needed questions answered now. And we went to an allergist. Oh, not to mention the supplements that they gave my daughter. She was so sensitive, she couldn't tolerate them. She actually had more reactions because of them. And when we did go to an allergist, I had this screaming baby in my arms because she was going through a reaction at the time. And I'm telling him what's going on. I'm pouring my heart out to him. And his response was, just feed her food. How do you think I felt? I felt completely invalidated. I felt confused. I felt overwhelmed. Like, what do I feed her? How? How do I do this? How do I make sure that she stops having these signs and symptoms? I didn't want to use Band-Aid solutions. I didn't want to use a medication that would just cover things up. I wanted to get to the root causes. Have you ever felt that way? That medical providers just don't get you, or they think that you're making things up? They don't actually listen to you. They don't validate your experience, and they don't guide you expertly. Because in that moment, when I was standing in front of this man, I was begging for help. I needed answers. I needed support. And what he gave me was the complete opposite. He didn't see me. He didn't see my daughter. He was looking at a checklist, and we didn't fit into that checklist. So he dismissed us. I want you to know that when we work together, when I work with clients, I validate your experience, because your experience is just as important as all the research that I've read and all the articles that are out there and all of my personal experience. Your experience matters. So when we work together, not just do I validate you, I guide you expertly. You get empowerment. You get clear action steps so that you leave our sessions feeling calm and confident, knowing exactly what you're going to do next. And I'm here for you. If there is a hiccup, if there is something that goes out of plan, you can reach out to me, and I'm here to guide you along the way. I'm here to hold your hand so that you don't have to feel alone like I did. Now, through this journey of helping my daughter, I actually discovered my own food allergies. I discovered my own leaky gut and poor gut health, which I had passed down to my daughter, and which she had. We're going to go into that more. But leaky gut and gut health is such a cornerstone of our health. This is where food allergies begin. This is where autoimmunity begins. This is where our hormone regulation begins. And so I started discovering about gut healing, and I jumped into this gut healing protocol, and I made all the mistakes. Again, we saw healing, but I didn't know what I was doing. I was sleep deprived, and honestly, some things were confusing, and I didn't realize how much customization and individualization needed to happen for our personal journey and experience. I ended up working with a practitioner, and even though she knew the protocol inside and out, she actually had a hard time supporting us because of the breastfeeding relationship and all the food allergies. So, according to the protocol, you just go A, B, C, D. Well, we had to skip steps. We had to move things around. We had to modify things. And so throughout that process, she was mentoring me, but I was actually mentoring her at the same time. And we had this beautiful relationship, which really worked for us because I had my own background as well. Some of you may not. And so that's why my personal experience, I've made the mistakes so you don't have to. And that's the thing. I know how to work with these sensitive populations. I know how to help these little ones. And again, food allergies are more complicated than some think. Then on our journey came the other aspects. Nervous system regulation, because we got to a certain place of healing, but then we kind of got stuck. We plateaued. So I realized that this was missing. Regulating not just my nervous system, but my daughter's. How do we co-regulate? And then the emotional aspects, the energetic aspects. And again, I went through multiple mentorships. I did so much continuing education, courses, learning, so that I could start getting clarity on how to apply these effectively, but also unlimited time. Because for the moms, you know how little time we have for ourselves. I had to figure out how to build this in. And that's the beauty of my approach, is I make this easy. I make this become a part of you and your identity. So it's not an extra thing on your checklist. It's not an extra thing to do. It becomes you. You are empowered on your healing journey because you literally transform who you are. So through this experience, I had this light bulb moment that why can't I help others? I have all this healthcare training and background. I have this lived personal experience. I didn't just read it in a book, right? I've gone through it personally. I made the mistakes. I've gone through the mentorships. And that's, again, how I started this practice. And so now you know why we're able to be here in this moment and how near and dear this is to my heart. And again, I wrote a book about our experience, especially the early years, because I knew that there were other moms, especially breastfeeding moms, who were going through this experience in that moment that needed support. And I had already built up a community, and the book did hit a #1 bestseller. And right now it's on Amazon, and it is on sale through Food Allergy Month. So again, this isn't just for breastfeeding moms, it's anyone on a food allergy journey, because I coach and guide you through practices and examples of how to communicate about food allergies, how to, interact in social interactions, how to express our wants and needs, how to really tune into how this experience is affecting our lives and how can we use it to transform our lives for the better. So again, Breastfeeding Bliss on Amazon. Go ahead and check it out. It's on sale through the end of this month, May. So now let's jump into some of the logistics of food allergies. Food allergies are an immune response to a food, a substance in a food derivative, or cross-reactivity with a food. Our body's natural defenses overreact to exposure that they identify as dangerous, and this triggers a protective response from the immune system. So let's break that down, because we're going to get technical, but I want to keep it as easy as possible. I use 3 categories. One is IgE-mediated allergies, non-IgE-mediated allergies, and food intolerances. Those are the 3 categories we're going to place a whole bunch of different conditions and signs and symptoms into. So when most of us think about food allergies, the most well-known are IgE-mediated allergies. These can cause anaphylaxis, hives, swelling, and other symptoms as well, which we'll go into. They happen immediately to exposure and up to 2 hours after. And this reaction can even be to trace amounts, cross-contamination, and they can be life-threatening. The immune system releases a flood of chemicals that can cause the body to go into shock. This is called anaphylaxis or anaphylactic shock. Blood pressure drops, your airways narrow, blocking breathing. The pulse may become really fast and weak. You may get a skin rash or hives. You may get nauseous, vomit, have diarrhea. You may feel dizzy and faint. If this is happening, anaphylaxis needs to be treated right away. This is a medical emergency. I cannot emphasize this enough. This is a medical emergency. You need an injection of epinephrine. If this isn't treated right away, it can be deadly. So if you or someone you know or you see is experiencing this, use an EpiPen right away. Call 911 or the emergency line in your country. Get the person to lie down with their legs up or flat if they can. And if it's a baby or a small child, hold them horizontally across your chest. The epinephrine in the EpiPen is adrenaline, which opens up airways and treats all the symptoms of anaphylaxis. There's a saying, epi first, epi fast. Even after epinephrine, there's sometimes a rebound reaction. And that's why individuals need to be closely monitored after an anaphylactic event. So for those who have experienced this, or the parents and caregivers of a little one who has experienced this, there are many emotions that come along with this as well. This is part of the healing journey as well. We need to process these emotions. We need to work through them, and we need to integrate them and also support ourselves through this process, because the stress levels of being a parent, a mom, a dad, a caregiver of someone with food allergies is high, and you need care yourself as well. And just a general guideline that I'm going to give is not to give antihistamines during a reaction, because what happens is they can mask the reaction. And antihistamines don't treat the swelling in the airway, which is what is life-threatening. So if you do have this type of allergy, an IgE-mediated allergy, you need to be working with an allergist, and you need an EpiPen. I still work with these clients with the root causes in conjunction with their allergist, but they absolutely need to be working with an allergist. For skin testing, for oral food challenges and trials need to be in office, etc. These need to be done with medical supervision. Now, I still work with the root causes, which are supportive of this. And again, this is where the healing happens. The allergist is going to give you that medicine that is going to be life-saving. Both are equally important. So those with IgE-mediated allergies need to be aware of cross-contamination, trace amounts, and even shared lines in food manufacturing. Shared surfaces in a kitchen, at home, or others' homes. And I coach on all of this, because this is the background stuff that you don't see when you see a typical food allergy diagnosis, right? People don't think of cooking. People don't think of communicating this with family and friends, with caregivers, with schools. I consult with school systems. I consult on 504 plans, which are medical plans for school as well. So if you're a parent with a little one, I consult on that, how to create a comprehensive 504 plan for you, how to advocate so your child gets the care and the treatment that they need. I work with teachers as well. I consult with teachers who have little ones with severe food allergies. Again, school systems, I coach on social interactions, right? So when we go out to someone's house, when we go out to a restaurant, etc., what are the precautions? What are the steps that we need to take? What are the plans that we need to have in place so that we feel confident and calm and empowered, knowing that we are doing what is in our highest and greatest health and wellness potential? Same thing with playgrounds, right? For little ones, I consult on how to deal with that circumstance depending on allergies. Again, visiting others, going out to eat, etc. I coach on the emotional aspects, the fear and the panic that many of us feel, how to stay calm, how to know what those next steps are, how to be prepared. This is the transformation. This is what transforms your experience. And with clients who do have IgE-mediated allergies, we work together to decrease the sensitivity and reactivity of the body and the immune system. Those are the root causes, to address those root causes and to heal. So again, the pillars that I work with are holistic nutrition. We need to make sure that we're not getting constantly exposed. And we also need to be aware of what are we eating? How are we nourishing our body? Because if we're only eating one or two foods, are we making sure that that is getting all of our nutrient needs, all of our nourishment needs? Again, the nourishment on an emotional and mental level as well, on a physical level. Then is integrative detoxification. And again, I'm going to go into these pillars in depth in a couple minutes. But integrative detoxification, our body is reactive, our immune system is reactive because there is a certain level of toxicity that is creating this immune response, that is creating this hypersensitivity in our body. Gut health and leaky gut are the root causes for food allergies. So when we heal the gut, when we heal and seal the gut, when we rebalance the microbiome, that is transformative. And that is when foods no longer become reactions, right? Our body doesn't no longer reacts to certain foods. We can heal that lining and we can decrease the reactivity and reverse it. Emotional energetics. When we work with the emotions and the energies of those emotions that are the underlying root cause of food allergies, that is where everything stems from. When we do that, again, we not only transform our mental and emotional health, we literally get physical changes, which I'm going to give examples of later as well. Nervous system regulation. When we learn how to regulate our nervous system, it changes everything. It allows our body to heal. It allows our body to optimally digest food. It allows us to do all the processes that our body has for metabolism, for digestion, for waste removal, for toxic removal, detoxification. All of these things are important to be able to work with. Then decoding the body, understanding what our body's communicating with us is absolutely such a crucial component. And understanding that our signs and symptoms, even of reactions, aren't bad. They're just our body communicating to us. It's our body's cry for help saying that something's out of alignment. So these are some of the things that I will be repeating throughout this masterclass, because again, these are the root causes for any of the conditions that we're going to be talking about today and more. And there are some things that I'm going to be repeating as far as management strategies, because they are the same as well for IgE allergies or any of the other allergies I'll be describing further on. These all apply. So the first myth that I want to bust and that I want to help you advocate for yourself or your child about is this phrase that a little bit doesn't hurt, quote unquote. Yes, it does. And this phrase is often said by well-meaning friends or family that maybe don't want you to miss out on something or have, attachments to food of their own, etc. And I think that the majority of them are well-meaning. They just really don't know. So I want you to know that with IgE-mediated allergies and others, this can trigger anaphylaxis, even with a trace amount, even with cross-contamination. This creates an immune response, even if it doesn't cause a full anaphylactic reaction. This stimulates your immune system and it activates your immune system. It increases inflammation and it increases the likelihood of more reactions. You're increasing inflammation, you're causing pain, you're causing harm to someone if you're giving them just a little bit. Over time, this inflammation, this can worsen leaky gut, It can actually lead to more food allergies. It can lead to autoimmunity and more. So if there's someone who you know has been saying this to you, someone who's near and dear to your heart, maybe a family member or friend, and they just don't know, share this video with them now and have them listen to this component, because sometimes it's just a misunderstanding. And hearing it from someone other than you is going to help them understand the importance and the severity of this, because we don't mess around with this. We need to be able to advocate for ourselves and have boundaries around these situations. Again, that's something that I coach on, because one, it's the other people, but at the same time, sometimes it's us. Sometimes we feel like we're missing out, or sometimes we feel like we're maybe inferior or not worthy because we can't have XYZ food. This is a large part of the coaching that I do. I just worked through some of this yesterday with a client during our live program call, because again, this is so much more than just food. This is our life. This is our entire experience. There's emotions that come along with this. All right. Now, the next myth, or not necessarily myth, but something that you need to be aware of for management, is we need to be aware of every ingredient in the food that we're eating. And so this means that you need to become an expert in reading labels. You need to be an expert in recognizing derivatives in food products and other products, because things are not just in food. They're in personal care products, they're in supplements, they are in different teas and herbal preparations, etc. We need to be able to identify these. We need to know how to call companies, what to ask for. We need to know how to call restaurants ahead of time, how to advocate for ourselves at restaurants. And we also need to know how to talk to our children about having allergies, because we don't want them to be terrified of food, because that can lead to eating disorders and all sorts of other conditions. And that's not going to help regulate their nervous system. And we also need them to understand that this is serious. So that's something that I've had personal experience with my daughter. She is now 6.5, and I know that's going to evolve as she gets older and as we have different conversations and different social interactions to work through as well. So when we talk about this, right, knowing how to read labels, how to communicate, etc., I have a course specifically on this. I initially made this course for breastfeeding moms, so there is a component of breastfeeding, but then I go into the depths of how to read labels specifically for milk and dairy elimination. So if this is something that you're interested in, go ahead and put dairy in the comments, and I will get that course, or actually put course in the comments. Course will be a better trigger for me to know to get that for you. So that is a course that I have. It is self-paced, and then we touch base as well. And again, I coach on all of the allergens, because myself and my daughter, we've been down to a 2-food elimination diet. So we have eliminated all the top allergens. We know what to look for. We know what derivatives are, how to avoid them, etc. So this is something that I am very familiar with, and I'm here to support you on, because it can be confusing. I made that first course on dairy and milk because that seems pretty simple, and there's still a lot to it. There are at least 100 derivatives that I give in there. There are resources, again, on communication, advocating for yourself, how to know how to scour labels. Any processed food is going to be a potential to have ingredients, and you need to check them again and again, because ingredients sometimes change over time. So this is so important. And I know many families who have been affected by this personally, by not being able to catch an ingredient change or not being able to read the label appropriately. And if that was you, there is no judgment, shame, or guilt, because I've been there myself. So I know. I just want to give you the resources so you don't have to make those mistakes. And again, the top allergens we'll go through in a minute, but the ones that are a little trickier are especially soy, with soy derivatives, even gluten, different nuts, corn especially. I have firsthand experience with corn and corn derivatives. And this is something that is really crucial, because corn is in processing and in very different places than you'd think. So you need someone guiding you through this journey to make sure that you're not getting exposure. Because again, that exposure is going to increase inflammation, increase reactivity. It's going to put your body into a hyperreactive state. The other thing that I want to mention is that IgE allergies can start at any time. They can begin again at any point in the lifespan. They can come on even after having multiple exposures to a food. And reactions may vary from time to time. So you may just get hives one time and you may have an anaphylactic relationship another time. It is all serious and it all needs to be managed appropriately. Again, for IgE allergies, you need to be working with an allergist, you need a medical plan, and you need an EpiPen. And I am here to support you to work through the root causes for healing as well. All right. Put a 1 in the comments if that was helpful. If you learned something new there, if there was something that you weren't aware of. And then put a 2 in the comments if you're realizing that there is more for you to learn, that there are still gaps in your experience, and that there are things that you need to put in place and put together for a transformative experience, for that confidence and clarity and calm and ease on your journey. Now, the next category I'm going to talk about is food intolerances. So there's been a lot of misunderstanding around this term, food intolerances, even within the medical community, and it's important to clear up. Because before I go into the larger category of non-IgE allergies, we need to make this distinction. So an intolerance is a difficulty digesting certain components of food based on a lack of enzymes. So when we say someone has a lactose intolerance, they don't create enough of the enzyme lactase to digest the sugar, the milk sugar, lactose, for example. That's why those people can drink Lactaid or take enzymes to help with digestion. It's just that they can't digest the lactose, that milk sugar in the milk. And that is different than an IgE or a non-IgE reaction. The immune system is not being directly activated and is not creating the symptoms. It is just a lack of the enzyme in digestion. So these people, those who have an intolerance, have purely digestive symptoms. This is usually diarrhea, constipation, undigested food in the stool, malabsorption. And this is, again, different than an IgE or non-IgE allergy, or an eczema reaction or hives, etc. Now, this, again, can start at any point in the lifespan, and sometimes babies can be born with this as well. This is rare, but it can happen. And I want to mention this because I know there are going to be some breastfeeding moms that are, and even not even breastfeeding moms, but just moms of little ones watching this as well. So when a baby has a lactose intolerance, they do not tolerate the regular formulas or breast milk, because breast milk and the regular formulas have lactose in it. Now, these babies never put weight on. They are failure to thrive. They are incredibly ill and not well right from the beginning. So that is something that's important to know. If you're seeing that in the hospital, in a family, a friend member, etc., have them do a test in the hospital. Okay, so there is something called a hydrogen breath test that they can do in the hospital, and they get results as far as if they're having a lactose intolerance. Now, in the Decoding the Body section that I teach, we also go over, if you're an adult, you can have this hydrogen breath test as well. But one of the things you can do is you can take an enzyme support and see if there's improvement. If that happens, then it's an intolerance. Because if it was a food allergy, taking an enzyme would not help you. One thing that I am just thinking of right now, I don't know if I went into testing really well for IgE allergies. I don't think I did. So let's mention that quickly right now. So IgE allergies There are skin prick tests and blood tests that they can do. That's at the allergist. And that is how you get the diagnosis of an IgE allergy. That's important to mention, because with those tests, you get confirmation that you have an IgE allergy to something. If that is positive, you need to avoid that ingredient, that food, at all costs, even trace amounts and cross-contamination. And you need an EpiPen. That's why that allergist is important for those. I'm going to go into more of the testing a little bit later, but I want to mention that now before I get too far ahead of myself as well. So with the lactose intolerance, right, we need to be aware of, one, babies can have this. It is rare, but it is possible. And, oh, where am I in my notes? Here we go. Okay, so it is possible. It can develop at any point in the lifespan as well. So again, there's lots of different ways that I coach on how to determine if you have an intolerance. But especially with babies, I just wanted to give you that information about the hydrogen breath test, because especially if you have a little one and they're having issues right from the start, make sure you get that test. And then if you need to, there are ways that there are homemade formulas that we can work with that I coach and consult on that are safe and nutrient appropriate and nutrient dense, not some of the stuff that you find online. These are going to be custom tailored. And there are specific formulas if you want to go that route as well. So when we talk about, again, intolerance, enzymes are created and secreted based on a whole digestive cascade. And we need to make sure that each step is optimized to make sure that the pancreas is making enzymes in appropriate levels and that they're being secreted at the appropriate time for digestion. So let's talk about this in a big picture, okay? There is a whole cascade that happens. So seeing food, putting food in our mouth, chewing and masticating the food, swallowing the food, going into our stomach, then moving into our small intestine, then our large intestine. There are, again, our liver and gallbladder are working in the digestive process. Our pancreas is working in the digestive process. And then it goes all the way through elimination. We need to make sure that all of those steps are optimized for optimal digestion. So even if you have a lactose intolerance or a different enzyme intolerance, a lack of an enzyme that's creating an intolerance, we can work with your digestive cascade to actually improve that, to support your body, to optimize your digestion. I want you to know that you can be empowered and there are things that you can do to heal and to improve this. So when I work with clients, we work to optimize digestion. We work on, again, holistic nutrition so that, one, we're avoiding the things that are creating irritation and inflammation right now, and we're making sure that you are appropriately nourishing your body with the foods that you are eating, because if we have mineral or vitamin deficiencies, those are going to put more of a strain on our body. And when we're giving ourselves the nourishment and the nutrition that we need, again, on a mind, body, and soul level, we also look at integrative detoxification, because all those organs that I mentioned in the digestive process, they're also detoxification organs. So we need to know how to support them, because supporting those organs can improve your enzyme production and secretion as well. So we need to, again, work the integrative detoxification in there as well. Gut health, crucial. Again, we're talking about digestion. We need to heal and seal leaky gut, and we need to optimize the gut microbiome. Again, I'm going to be going in depth on all these in just a few minutes. Emotional energetics. So discovering what emotions are trapped in different organs, what energies of those emotions can create stagnation and blocks, and how they're affecting our digestion, how they're affecting our enzyme production, etc. How do we integrate those? How do we work with those? And how do we transform our emotional and mental experience? Nervous system regulation. So how does our nervous system, again, affect our digestion? Because that is absolutely related and such a key component that most people don't talk about. And again, we're going to be going over in depth in a minute. And then decoding the body. Again, our body is giving us messages. Something is out of alignment. How do we understand what the body needs? How do we give it what it needs? How do we detoxify what it needs to detoxify? How do we support it? How do we work with our body as our ally? So just like the IgE allergies, when we talk about a little bit doesn't hurt, right? If you hear that from someone, even with an intolerance, you're still increasing inflammation. You're still increasing irritation. You're creating pain and discomfort. You're creating digestive issues. Over time, repeated exposure can worsen leaky gut. It can lead to more food allergies, actual food allergies. It can lead to autoimmunity and more. We don't want to keep exposing our bodies to this without supporting our body optimally. There is a process and a way to reintroduce things as we heal so that we can start working with our body again so that it starts to produce those enzymes with graded exposure. There's a whole process that I work with clients on with this. And again, it's important to read labels. If you have an intolerance, we need to look and be aware of derivatives in products. We need to know how to advocate for ourselves when we go to restaurants. We need to know how to talk to our children if our children have this. Again, the course that I have for dairy specifically is going to be very appropriate to you as well, especially if it is a lactose intolerance. So go ahead and put course in the comments, because in there you get training essentially on how to read labels, how to look at derivatives, what are the derivatives to look out for, how to advocate for yourself, how to communicate your needs. This is so important to know how to do on your journey. And then again, we need to look at all of those 6 pillars for an ultimate health transformation. Again, a lactose or other intolerance can start at any time based on those root causes and how things are presenting on your journey. Another thing I want to mention is that people who have been on a vegan diet or lifestyle can have a intolerance and a lack of enzymes in digesting meat protein and other proteins as well after being vegan for a portion of time, because our body adapts. And so if you have been vegan and now you are attempting to eat animal products again and you're having a hard time, again, either with lactose or meat or anything like that, this is a sign that your body is not producing or secreting the enzymes needed to have that food in this moment. And that's where, again, working together is really important to create your custom plan on how do we work with your body to start supporting those organs, to start stimulating the production, and how to start creating a plan for your digestion to optimize that, again, on all levels: nutrition, detoxification, gut health, nervous system regulation, emotional energetics, and decoding the body. So that is an area that I specialize in as well. I actually did a great interview with this on the Radiant Health and Wellness show. So put vegan in the comments if this is you or you'd like more information about this, on how to transition from being vegan to starting to eat animal products again. So again, just to recap, a food intolerance is a lack of an enzyme that creates difficulty digesting certain components of a food. This is widespread. The last research that I saw was that 65% of the population worldwide has a lactose intolerance. That's just lactose, not looking at any of the other enzymes. So not to mention the enzymes for fat digestion, for protein digestion, for carbohydrate digestion. This is also a part of the leaky gut presentation. Most people don't realize that their GI distress, whether it be constipation, diarrhea, stomach pain, irregular stools, and more, stomach pain, this can be related. I'm going to be doing a whole masterclass just on digestion and GI conditions. So if you like that, again, just make sure you put series in the comments, sign up for that whole series to get the notifications and the access to that one as well. All right, so now non-IgE allergies. This is the third category now, okay? Non-IgE allergies are still a sensitivity of the immune system and an over-response of the immune system, but they are mediated through different antibodies and a different part of the immune system reacts. So that's why this is what most people call a food sensitivity, but it can have many different presentations that we'll go through. And I don't like the word food sensitivity because it is so broad and so widespread. and it doesn't give you an exact idea of what you're working with. When we talk about non-IgE mediated allergies, we understand it's an immune system response. That is so important to know because we deal with it a little differently. Okay, the treatment, the presentation, the navigation is going to be different. So what are some of the symptoms that you may be experiencing if you have a non-IgE mediated allergy? You may have GI conditions such as diarrhea, constipation, gas, blood or mucousy stools. You may have vomiting or reflux or GERD. You may have hypovolemic shock, which is from repetitive vomiting, which we'll go over more. And this is life-threatening as well. And so that's why it needs to be differentiated. When we're dealing with the immune system specifically, this is very serious. Hypovolemic shock is a medical emergency as well. I think I mentioned eczema already. You can have symptoms as brain fog, anxiety, mental and emotional health come up, hives, pain, etc. The signs and symptoms and presentations are very widespread and different and vary person to person. So again, I'm going to go through many of the different kinds. I don't know if I covered all of them, but many of the different kinds. And I'm going to give you an idea of the signs and symptoms to look out for now. And it's important to mention testing as well, because like I mentioned earlier with the IgE-mediated allergies, skin prick testing and blood testing with an allergist is the gold standard, as well as oral food challenges. Those are going to be the testing that you want to do. You need to have an allergist for that. For intolerances, there is a hydrogen breath test for lactose intolerance, and as well you can work with enzyme support to help test and support. And as well, there's other ways to decode your body to understand what you're having and what you're experiencing. And then with non-IgE allergies, there are no great tests, so other than an oral food challenge. So let me go into this, right? If you have ever gone to an allergist and you had skin prick testing or blood testing and it came up negative, but you're like, hey, I have all of these symptoms. It came up negative because it was not an IgE allergy. It was a non-IgE allergy the majority of the time. Now, this is where the medical community, I think, does not support patients and clients well, because most allergists at that point, like we experienced, will say, nope, you don't have an allergy. Don't worry about it. Just eat, feed your child, do whatever. Well, you're going, hey, there's something happening here. They're getting eczema, they're getting stomach pain, they're getting bloody diarrhea, they're getting vomiting. We don't want to ignore that. But I want you to know that that will not come up on a skin prick test or a blood test. Now, same thing, there's something like that. It's called food intolerance testing or food sensitivity testing. What I want you to know, that is a tool, but it has very low specificity and it gives a lot of false positives. So this is not something that I typically recommend people to get. If you have, it is a nice thing to have, but it's not a necessity to have, because there are other ways that I coach on, especially in different methods and tests where we decode the body and start identifying what foods you are potentially reacting to. So I typically don't recommend this food allergy testing. If you'd like to get it, you can go ahead. It gives us some information, but they're not all that accurate. So I don't rely on them. Now, some of the ways that you can just start decoding the body, just based on some of the things that I'm going to tell you, are that symptoms are typically delayed with non-IgE allergies. So they're typically 2 hours or later, and they can be days later as well. Now, what happens with this is that it's tricky. It's not as easy to correlate causation, and it won't, again, show up on the skin tests and the blood tests at the allergist. So when we're working with non-IgE allergies, your signs, your symptoms, decoding the body, and your history are the most important here. And again, they vary widely person to person. So that is what I am an expert in, recognizing the patterns, starting to decode what your body's telling us based on your history, your signs, and your symptoms. Now, I do want to mention that even non-IgE allergies can be life-threatening. This is, again, something that most people aren't aware of. Some of the signs and symptoms and presentations we're going to go look through now. So one condition is called FPIES, F-P-I-E-S, food protein induced enterocolitis syndrome. This is something that I know very personally, and I have a whole masterclass that's specific just to FPIES. So if you would like that, just put FPIES in the comments. But what this presentation is, there are two presentations. One is an acute presentation. So this happens, again, about 2 hours after digestion, after exposure or not indigestion, after eating the food or exposure to the food. So it's delayed about 2 hours, and it can have signs and symptoms like profuse vomiting, diarrhea, weight loss, dehydration, temperature changes, low energy, and you can have something called hypovolemic shock. What this is essentially your body loses such huge volumes of fluids, so especially through repeated vomiting, that your blood pressure drops, and this is a medical emergency. You need IV fluids. You need to get these adults or kids, these individuals, medical care as soon as possible. What happens often is that these families will go to the ER, and the medical personnel will be like, oh no, they just had a stomach bug or food poisoning. They just vomited a bunch. Don't worry about it. No, you know your child. If this is something that is repeatedly happening, or even the first time, if you have a gut response, I'm talking from a parent's perspective now, right? If you have a gut response, or if you're an adult that's going through this and you vomited so many times and you feel your body starting to shut down, get IV fluids as soon as possible. This is where it helps to have a written plan. This is something that I consult with to create your plans on and to advocate for yourself, empower you to keep advocating until you get someone to give you IV fluids, because this is a medical emergency and this is life-threatening. We need to be able to hydrate because of all of that huge volume loss of fluids during the vomiting and diarrhea. Over time, people who have this may have failure to thrive. They may have food aversions because the experience is so horrible. Okay. There's a chronic side to FPIES as well. And again, the signs and symptoms happen 2 hours after or more, even days after sometimes, from personal experience and clients' experiences. They include nausea, vomiting, stomach pain, diarrhea, bloody stools, reflux, vomiting, malabsorption of food, poor weight gain, and more. Now, again, FPIES is just one presentation. Let's differentiate it between other conditions that you may have heard of. The next one I want to mention is FPIAP, food protein induced allergic procticulitis. What this is just the lower GI symptoms. So things such as diarrhea, bloody stools, mucousy stools, stomach pain, cramping, malabsorption of food in the stools. When this happens, that's this category that I would go into. As I go into the different categories and labels, I don't want you to worry too much about them, but this may help to give you some insight. And the reason why I don't worry too much about the labels is because the root causes are the same. And for all of the non-IgE allergies, the treatment and the practice is going to be the same with the variations for individualization, right? So FPIAP, lower digestive. FPIES that we just covered is both upper and lower GI symptoms. Next is GERD or reflux. Now, this is primarily just the upper GI system, okay? So this is with the esophagus. This is in the stomach as well, in the esophagus. And so we need to differentiate when we're talking about GERD and reflux. We need to differentiate between something structural. So this can be with the structures of the digestive system themselves. If it is a breastfeeding child or baby, we need to look at oral ties. We need to look at, again, if it's breastfeeding, the breastfeeding relationship as far as oversupply or heavy letdowns. And then we also need to look at the digestive properties themselves. So the timing of our food, the chewing and swallowing of our food, stomach acid levels, etc. So reflux needs some more diving into. That's where, again, this customization and individualization of working together really is important. Next, I want to mention EOE, eosinophilic esophagitis. Now, what this is an autoimmune condition that affects, again, the upper GI. So this presentation is similar because it is still triggered by certain foods, but what ends up happening is it is severe pain with swallowing, severe difficulty with swallowing, reflux as well. This is an autoimmune condition. So again, a little bit of a different presentation, a little different way of approaching it and treating it, but the root causes are still the same. Next is MCAS, mast cell activation syndrome. This is when our mast cells become overly responsive and release a lot of histamines, and there becomes a histamine overload in the body. This can lead to hives. This can lead to different global presentations as far as feeling unwell. It can have multiple signs and symptoms that we already mentioned earlier, including the GI symptoms. Now, with this is, again, a little bit of a different presentation, but it is food triggered as well. And it is something that I work with more. I look at this more on a global level and an immune system level as well. Next, I want to mention eczema. So eczema is a rash that appears on the skin. It is typically very itchy. And what happens is with eczema, we also need to look at differential diagnoses because there can be viral eczema that shows up. And as well, when we look at hives in an IgE reaction, sometimes hives can happen with non-IgE reactions as well. They are just delayed. So we need to be able to differentiate that as well. What kind of skin presentation is happening? There are lots of other skin presentations that happen that we need to differentiate. And often, again, it is food triggered. So certain foods, but also chemicals can trigger eczema. Toxins can trigger eczema. And it's a sign that you need detoxification support. Very, very much so. When things are, one of the ways that our body detoxifies is through the skin. And in my mind, it's almost a last resort. So if our other detoxification pathways are not working well and it's showing up on our skin, then it means we need to work on detoxification. We need to support our detoxification organs. We need to open our pathways, and we need to focus on that. I want to mention colic. So again, for those who have little ones and babies, when a baby is screaming for hours a day, it is not just a phase. This is a symptom. This is a sign of pain. There's something going on. And yes, babies cry. Crying and screaming for hours and hours a day is different. As a mom or a caregiver, you probably know the difference in your heart and in your body when it happens. So with colic, it is just a symptom. That's where I work closely with moms and caregivers to look at the whole history, all the signs and symptoms, and create a plan specific for that little one. Now, I did want to mention that sometimes some people have a mixed presentation of IgE symptoms and non-IgE symptoms in one reaction. That can happen. What that means is that multiple parts of the immune system are being triggered at once. So as we go through this, you can see there's lots of different labels. We're going to go into a couple more differential diagnoses in a moment. And I also want you to know that there are other GI conditions as well that I'll be going more in depth on during the digestive and GI masterclass. So again, make sure you subscribe to the full series to get access to that. Just put series in the comments and I'll get you the link. So now I want to take a moment to address things like CMPA, cow's milk protein allergy. Now, this is important to note that CMPA can present in any of the above signs and symptoms and presentations. And this is where it gets tricky. This is why sometimes in the allergy world, I think there's too many labels, because all CMPA means is that you're reacting to cow's milk. So you can have eczema from it. You can have digestive issues from it. You can go into anaphylaxis from it. You can have diarrhea from it. You can have all sorts of different things. So this is just a label saying that it's cow's milk, which is the trigger, but it doesn't say anything about how it presents person to person, and it presents very differently person to person or child to child. MSPI is another one. What this stands for is milk soy protein intolerance. Again, this is a misnomer because it's not an intolerance. We're not working with enzymes here. We're talking about an allergy. Typically, and again, it can be an IgE allergy or a non-IgE allergy. So all it means is that milk and soy are creating reactions. And now the protein part in this, just like earlier in the FPIs and the FPIAP, it's not just food proteins. You can have a reaction to a food derivative, to an oil, to a fat. It's not just protein, which is important to mention as well. So again, MSPI is just a label that it's milk and soy that you're reacting to, but it says nothing about the actual presentation. MFPI is another term that goes around, which is a multiple food protein intolerance. Again, not an intolerance, it's an allergy. And we are talking about just multiple foods create a reaction. We don't know which ones. Celiac disease is another one that I really want to mention because this has special considerations. So celiac disease is an autoimmune condition to the gluten protein. So when you consume anything with gluten, it can be wheat, it can be barley, other grains as well. That's the word I was looking for. So when you consume any kind of gluten, your body goes into an autoimmune reaction. So not only does it see the gluten as an invader, it starts attacking yourself. And with celiac disease, there are different blood markers that we look for. So labs are very important to get with celiac disease to specifically diagnose that. And there is an endoscopy that you can do as well, where they look at your colon and your intestines to see if there are signs of celiac disease there. Again, with celiac disease, it is autoimmune and healing can occur. That's important to mention. One of the other things that I want to say is that if you feel that you have a challenge digesting gluten or you have symptoms with gluten, it is really important to get the lab work before you eliminate gluten. The reason why is because then the lab work and potentially the endoscopy is not going to be accurate if you're not consuming gluten on a regular basis. So that's one of the mistakes that I made early on. And myself personally, I still live as a celiac. And I have a question mark because I was eliminating gluten for too long already before I went and got testing. So regardless, I want you to know that we need to do the lab work first. That's something that I can work with you to make sure that you get the appropriate lab work. And at the same time, we can still work with autoimmune diseases. Even with celiac disease, we can heal and seal leaky gut. We can rebuild the microbiome, and we can experience healing and health and transform our lives. One other piece that I want to mention with celiac is the special considerations are that we have to be extremely careful about trace amounts and cross-contamination with gluten. You need to be aware of personal products, restaurants specifically. There are specific coaching that I give for eating out, for eating at other people's homes, etc. And that is, again, where the support is really important. All right, we're getting to the end here. The last one that I want to mention is oral allergy syndrome. So this is a pollen food syndrome. It's a hypersensitivity that is to certain raw fruits and vegetables and nuts, and it typically occurs in people who have pollen allergies. So this is a cross-reactivity. So with pollen food syndrome, people who have pollen food syndrome can tolerate fruit and vegetables when they're well cooked. So this is a kind of caveat, something that is not well known, but I actually personally know a whole bunch of people who have it as well. So I just wanted to mention that as well. And that's one of the ways that you can decode your body. If you have a reaction when you eat something raw, if you cook it and you don't have the reaction, that's a sign that it is more than likely oral allergy syndrome. All right. So it may be confusing with all of these overlapping labels, right? And I don't want you to get attached and identify as a label as well. Because, like I mentioned, the root causes are all the same. And it is important to work with those root causes for healing and resolution and improvement, and also know how to navigate and support your body and create a plan that's custom and specific to you. So when I work with clients, again, we're going to go through all the pillars in just a minute. We work on holistic nutrition, integrative detoxification, gut health, emotional energetics, nervous system regulation, and decoding the body. So like I mentioned with all the other ones, we need to, even with non-IgE allergies, a little bit does hurt. We can't expose ourselves and keep exposing ourselves, because even with trace amounts, we are creating inflammation. We're creating inflammation. It is increasing our likelihood for more reactions. It is increasing our leaky gut, which is causing more food allergies and autoimmunity, pain, discomfort, and more. Even with non-IgE allergies, we need to read labels. We need to look at derivatives in products. We need to know how to call companies, know what to ask for. We need to know how to advocate for ourselves in restaurants. We need to know how to talk to our children about this. And we need to be able to learn what are our root causes. What is it that's specific to us? And how do we work with that? What is our body trying to communicate with us is out of alignment. So again, I have the course that's specific to dairy, but it teaches you how to read food labels, how to look at derivatives, how to understand what it is as far as communicating our needs about allergies and how to navigate them in our world. So go ahead and put course in the comments if that is applicable to you. And then again, I coach on all the allergens, because any food can be an allergen. And again, myself personally, I've been down to a 2-food elimination diet, so I know what to look out for. I did want to mention the top 14 allergies, just because some of these are a little unexpected, but they are important. So celery is a top 14 allergy. Again, gluten, so things like wheat and barley and oats. Crustaceans, so seafood, right? Prawns and crabs and lobster. Eggs, fish. Lupin is another unexpected one. Milk products, mollusks like mussels and oysters. Mustard is another unexpected one. Peanuts, sesame, soybeans, sulfur dioxide and sulfites, and then tree nuts. So these include almonds, hazelnuts, walnuts, Brazil nuts, cashews, pecans, pistachios, and macadamia nuts. Now, again, it can be a little confusing because you can tolerate 1 or 2 or 3 different kinds of nuts, but you may not tolerate the 4th nut. So that's where, again, we need to be really aware of cross-contamination and how do we create a plan to keep you safe or your little ones safe as well. Again, non-IgE allergies can start at any time. When we look at the root causes and we work with the root causes, that's how we can start resolving them and healing them. You can have a non-IgE allergy develop after multiple exposures to a food. Reactions may vary from time to time, so you may have a different reaction one day and a different reaction the next day, and you need a plan. So especially if, again, having a medical emergency plan in place is crucial. Having a school plan in place is crucial. For social events, for travel, having a plan in place, knowing how to communicate it. And again, for school, I consult for 504 medical plans. So I help you make sure that you have the most appropriate and comprehensive plan for your child as they go on to daycare or school, whatever. I also consult with school systems on this as well. So throughout all of these food allergies, the immune system and gut health are crucial. And this is a large mechanism of action, right? So put 1 in the comments if you've gotten clarity and a deeper understanding of food allergies so far. Put a 1 in the comments if you have had an aha moment where you started connecting the dots of the different signs and symptoms or your presentation, or maybe the labels, you got some clarity on that. Put a 1 in the comments if that made a difference for you. And again, share this with someone you know is going to benefit from this information as well, whether it is a family member, a friend, a school system, a teacher. let them know. So again, if you feel comfortable, share in the comments which one you think you have or your child has based on the signs and symptoms that they're presenting. And you can just put the category. Is it IgE allergy, a non-IgE allergy, or an intolerance? Or are you not sure? Go ahead and put not sure in the comments. That's okay too. And again, if this approach that I'm presenting to you with the Radiant Health Protocol resonates with you, and this level of care that I provide is something that you need and you want on your journey, you want a practitioner who's going to listen to you, who's going to work with you, and you want to address the underlying root causes of food allergies to heal and see improvement with confidence, clarity, and calm on your journey, go ahead and put Radiant in the comments, click below, and get the discounted package of support with a month of support today. So I did want to add a few other pieces before we jump into the pillars. And we're going to start with breastfeeding because, again, that's such a subspecialty of mine. And I just want you to know that not all babies react through breast milk. So if you were breastfeeding and you were eating all the things and your baby did fine, that's great. And sometimes they may react when they start getting solid foods. Some babies, though, like I personally experienced, do react through breast milk and solids as well. So we need to make sure that we have a plan set in place, especially if they're already reacting through breast milk for solid introduction. And if you are suspecting it or your baby starts having reactions, then we need to have a plan on how to proceed forward as well. And again, you can react to any food, to any ingredient, to any derivative, to any oil. It doesn't have to be a protein. Even trace amounts, even cross-contamination can create a reaction. Again, sometimes these presentations are mistaken for a GI bug, food poisoning. You know yourself and you know your child. If you are seeing a pattern, if this is something that's repeated, or if you're just seeing signs and symptoms and you're curious, reach out. We can work together to see and get clarity about what you're experiencing and what's going to be the best plan for you. Now, I did want to mention one of the contributing factors now, and I'm going to mention more as we go through, but genetics plays a part in this as well. So I often get asked, are food allergies genetic? Yes and no is my answer. So yes, there is a genetic predisposition to food allergies. And at the same time, no, because it's not a guarantee that if you have food allergies, that your child will have food allergies. There is also something called epigenetics. And this is a study of research where they look at experiences and how that affects your genetics, how that affects your presentation. So that is really important to note as well, because when we are looking at this, we need to take part into account our diet, our lifestyle, how that is potentially activating and changing the expression of our DNA and genetics. That's equally as important. So we're going to go through more contributing factors now, and we're going to talk about the underlying root causes and what we can do with them, because that's where the epigenetic piece comes in. That's the empowerment piece, is you may have the genetics for something and you can do something about it. And you're empowered to look at the underlying root causes and work with them. So this is the Radiant Health Protocol, these 6 pillars. And keep listening afterwards, because we'll bust some more myths and answer frequently asked questions.